My name is James Wood, and I have been a trial lawyer. I specialize in medical malpractice for over 30 years. Our client develops a small bowel obstruction. The way that you treat a small bowel obstruction is primarily with an NG tube, a nasogastric tube, which is a tube that goes through the nose and then down into the stomach, and it sucks out the contents as well as air, and that takes the pressure off the obstruction. The doctor ordered an NG tube and no, one was not placed. The hospital did not have someone capable of placing the NG tube, so he had to have surgery to actually open the small bowel. And think about that, that's gutting somebody. During the course of the surgery, the doctor used Seprafilm improperly, and it caused a subsequent small bowel obstruction. They failed to tie off or ligate some arteries, and Nathaniel almost bled to death. That then caused what's called short gut syndrome. Treating it is a very complicated life care plan that the patient's going to have. So that ultimately became our goal in the case, was to get him the treatment that he needed as a result of the short gut syndrome. We used some work from DK Global on that. We used some visuals and animation that actually showed a complete gut. Then it visually showed all of the parts of the gut that had been removed as a result of the negligent surgery. The animation that DK Global created working with us and our experts was initially the gastrointestinal tract. It worked all the way through the gastrointestinal tract, from the mouth, through the rectum, and all points in between. The DK Global created an obstructed bowel, and they showed the obstruction, and you could see the obstruction on the animation. Then we brought in a nasogastric tube or an NG tube, and it was put through the nose down into the stomach, and you saw contents sucked out of the stomach and air sucked out. You actually see the decompressing and opening, and you're able to visually see that. The defense's initial offer in the case was $1 million. And they stayed at $1 million for the longest time, and then they got to $2 million right before trial, and then during the course of trial they offered $6 million. That was right at the end of the trial, and then of course the verdict was $23.8 million. In this case, we made a decision to go with DK Global because we wanted to make sure we could make it clear. We wanted to make sure we could, illustrate the GI tract. We wanted to make sure we could illustrate a small bowel obstruction. We're fanatical about visuals. Animations give us a tremendous advantage. I can't imagine going in and building a case without significant visual aids, because it just helps you focus, it helps you tell a story. If you're not doing that, I don't see how you can effectively communicate.